What's Up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for November 30, 2020. ICU nurse LACIE GOOCH on Nebraska's horrific outbreak and a desperate plea to take a break. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to LACIE GOOCH, an intensive care unit nurse at the University of Nebraska Medical Center in Omaha, one of the many hotspots in the current COVID-19 surge. She and her colleagues are exhausted and afraid of all that is to come. Let's listen.
LACIE GOOCH, thank you so much for joining me.
Hi, thank you for having me on.
So, LACIE, you are an ICU nurse in Omaha, Nebraska, and I'm wondering if you could tell us a little bit about what you're seeing when it comes to COVID.
Yeah, we're just seeing a lot of more patients coming in with COVID. Our hospital is pretty much full. We have 10 units just of COVID patients. That's not even including all of our other patients that we have in the hospital. And I know one of those units that we have is just for patients to go and pass away, unfortunately. We're calling it the Comfort Cares unit.
And it must be so hard to see that many people who are that sick.
Yeah. I mean, I am an ICU nurse. I'm used to seeing patients who are really, really sick, but these patients, it's a whole nother level of sick that we're just not used to. There's people, normal oxygen saturations we like to see them 95 to 100%. And with the care that we're providing, some of them are able to maintain that with the oxygen that we're giving them. But I remember a patient I had was on pressurized form of support called CPAP. And I took the mask off of her that was giving her that support for maybe 2 seconds so that she could just have a sip of water, and her oxygen dropped within 2 seconds down to 70% without that support. So I haven't quite seen anything like that before that I am seeing in COVID.
It's a new disease for all of you.
Yeah, absolutely. I mean, the precautions that we're having to take, and we're learning new things about it every day. I've seen a lot of patients who are getting strokes from COVID. Some of them are having cardiomyopathy, kidney failure. It's just kind of crazy to see how it's affecting the whole body.
And you are really in a hot spot there. I know that you've got about a 15% positivity rate. And I know that I read some stat that said if Nebraska was a European nation, you'd have the 5th worst outbreak in Europe. So those are pretty scary numbers.
It is scary. I did see that actually. And I was a little shocked that it was that bad compared to other places. I mean, I knew it was because I'm working it, but once you see those numbers, it's kind of shocking.
So how would you say a day is different there than it was pre-COVID?
Yeah. So I pretty much live in an N95 mask. We have the gowns, we have the face shields, and the gloves that we wear. And I go into my patient's room and I can easily spend an hour in their room and, have to take all my precautions off and throw them right back on again to go into my next patient's room. And I pretty much do that all day. I feel like a ping pong ball bouncing between patients and providing the care that they need.
And I understand that it's really hard. Sometimes you have to perform life-saving measures, but it's hard to get there in time. Yeah,
I specifically remember one time I had a patient just suddenly drop their blood pressure and oxygen saturation. And I'm sitting outside their room, and of course I have my mask on, but then I have to throw my gown on, make sure it's tied in the back, make sure I have my face shield on, the gloves, the whole 9 yards. Meanwhile, I need to get other people there to help me. So once I got in there, I was able to perform, whatever measures needed for that patient. And at the same time, the doors closed. Everybody I need to help me and give me orders are outside of the room. And so we're having to scream and yell at each other between a door, telling me by myself and not with that patient what else can be done. Because as a nurse, we can't do anything outside of our scope. And so anything we do has to be ordered from a physician. So they're standing outside telling me what else I can do for them while I'm by myself trying to do that for the patient.
That sounds really scary.
Yeah, it absolutely is. I know what I can do as a nurse, but without those orders, without the doctor's guidance, my hands are kind of tied. And being in there by myself, it's scary, like you said.
Do you have patients who don't believe in COVID?
I do, actually. Within the last week or two, I took care of someone who has been intubated and extubated and intubated again because of respiratory failure to COVID, and he still doesn't believe it's real, which is kind of shocking to me, and I think to a lot of other people, considering that's what has him in the hospital and so sick.
What has he said to you?
He kind of in and out of delirium at this point, unfortunately, but just like COVID isn't real.
It's sort of scary. And you have a message for people, who may not be taking this very seriously.
Yeah. Nursing has just been one of the most trusted professions, for years and years. And I think now more than ever, you need to trust us when we say that these are the sickest patients we've had in a long time. And we need your help by wearing a mask and social distancing and just taking it all seriously, because we are overwhelmed. And soon we fear that if we go to capacity at the hospital, it could prevent us from taking care of other patients in emergencies. I know one of our doctors, Dan Johnson, spoke with another news station and explained that, what if we are full, every bed that we have is full and we don't have any more room to spare? What happens if one of your loved ones has a heart attack? What happens if someone gets in an unforeseen car accident and we're unable to give them a bed to take care of them? And to me, that's the scary thing. I want to be able to provide care to the whole community and any need that they have. And so that's my main concern, is that we'd get to that point and wouldn't be able to do that.
Are you personally or seeing this, are you feeling burned out?
I'm exhausted. I don't want to say I'm burnt out because I'm not ready to give up. And I know neither are my coworkers, but there is exhaustion there. And it's only going to get worse if we continue down this path. And so I'm afraid there is going to be burnt out. There are going to be nurses who are fed up and just say, I'm done.
Do you feel, and I imagine you feel like this is going to get worse before it gets better?
Oh, absolutely. A big fear of ours is the holiday season coming up. Thanksgiving and Christmas and New Year's Eve are a time where families and friends like to come together and celebrate. And I am one who traditionally loves to do that too, but this year it's just different. So we're asking, don't have those big gatherings. Stay within your home so you don't potentially spread it throughout the community.
You recorded a video of yourself after it would look like a pretty long shift, and it has gone viral. 500,000 people have seen it. What made you record that video, and how do you feel about the fact that it's really resonated with people? I made the video because at the hospital, we're really just at our wit's end. We're trying to get the message out to everybody and plea for help, because we don't want to get to the point where, like I said, we can't provide that care to any other member of the community who has an emergency.
And I am kind of shocked. I wasn't expecting this kind of response. But at the same time, I'm glad it got that response because we need to get the word out there. So it worked.
Well, LACIE Gooch, thank you so much for everything that you do. And thank you for sharing your time with us.
Yeah, absolutely. Thank you for having me on.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.